My name is Nick Hardwick. I think I've ended up convening this because I'm a patron of the Zahid Mubarak Trust, but I was also Chief Inspector of Prisons and Chair of the UK MPM, and am now Professor of Criminal Justice at Royal Holloway, the University of London. I'm not going to ask everybody to introduce themselves because if we did that, that would take all morning. But I will ask people if they speak and make an intervention to introduce themselves at that point. Remind you at this point, this is being recorded and we'll make a copy of the recording available to you. And to say that if you do want to ask a question or just to comment, we'd ask you to do that using the chat function. Which we can also then save and circulate. So we'll have all of those comments. And it's easier if we do it that way, we can try and get questions that a lot of people want to be answered and make best use of the time that we've got available. By way of introduction, this webinar, I think, was the brainchild of Steve Kreiner from Australia, who set up something similar for monitoring bodies in Australia, New Zealand and Canada, I think, Steve. And then we approached him to help us get something organised for the UK and Ireland, and he's really been the motivator behind a lot of this, so thank you to him. But the meeting is actually being, the two groups that actually convened this meeting are the Zahid Mubarak Trust here in the UK and the Irish Prison Reform Trust. And I'm going to ask Katuna and Fiona from both of those to say a few words of introduction in a minute. Obviously, the main kind of event today is to hear a presentation for Dr. Jens Rudbeck, who will be known to you as the chair of the UN Committee Against Torture and has a 20 years or more history of being in the forefront of the fight against torture. And I know that his presentation was really well received in the previous seminar in Australia, so we're really looking forward to hear what you've got to say, Jens. What I'm then going to do is then ask Malcolm Evans, Professor Malcolm Evans, who's chair of the UN SPT, to make a brief response. I'll also ask Dr. Helena Steinhardt, who's vice chair of the UN Working Group on arbitrary detention, to say a few words, and Mark Kelly, the vice president of the European Committee on Prevention of Torture. So I'll ask their responses first, and then we'll throw it open more generally for comments and questions. And then I'll ask Katuna and Fiona maybe say a few words at the end. So I think the whole thing is going to take about 80 or 90 minutes, so we'll definitely be finished by 10:30. So I think that's all I needed to say. Oh yeah, one more thing. Can you all mute while you're not speaking? That way we can avoid, you get feedback and stuff, and that would be helpful just to make sure with a big number everything goes okay, and use the chat room to comment. So to kick off then, and maybe to begin with asking Katuna to say a few words of introduction.
Unmute me, please. Good morning, everyone. My name is Katuna Tsinsatze. I'm the co-director of the Zahid Mubarak Trust, an independent organization set up following the public inquiry into the racist murder of the 19-year-old Zahid at Young Offenders Institution in 2000. We are one of the few criminal justice charities providing external scrutiny in prisons, currently working across 16 establishments. Our focus is on equality, specifically on the treatment of and outcomes for minority ethnic prisoners. This group remains disproportionately overrepresented in England and Wales in prisons and evidently experiences disproportionate negative outcomes. Prison monitoring is one area we are especially interested in, And needless to say that this interest has been amplified in the face of the current pandemic. Since COVID-19 has started to spread across prisons, we find ourselves with more questions than answers about its impact on the people who live and work in our prisons. We recognize the unprecedented challenge this pandemic creates for the criminal justice system, but we also recognize the need for transparency, accountability, and independent oversight. These recent developments in prisons highlight the need to be vigilant in what could potentially become the new normal. Prisons in England and Wales are currently on lockdown, and things can go very wrong without external oversight. The threat from this pandemic provides the most compelling argument for joint work now, finding and sharing creative solutions from other jurisdictions. It's genuinely a pleasure to see so many of you coming together for this seminar at such short notice. This is the first initiative for us in partnership with the Irish Penal Reform Trust, put together with support from Stephen Caruana and Professor Nick Hardwick. We are looking forward for taking the findings from this event to inform our future work around external scrutiny in prisons. Looking forward to hearing from Dr. Modwick, as well as your comments and questions on this important subject. Thank you.
Thank you, Katuna. So now, Fiona, do you want to say a few words?
Morning, everyone. I'm Fiona Nicaneda, and I'm Executive Director of the Irish Penal Reform Trust. We're delighted to co-host this morning's seminar with the Zahid Mubarak Trust and with Stephen Caruana, who is a friend and colleague to many here. Established 26 years ago, IPRT campaigns for progressive penal policy reform in Ireland, driven by our commitment to human rights, equality and social justice. All of our work is informed by two core principles: that the human rights of everyone in the penal system must be respected, and that imprisonment should be a sanction of last resort. These same two principles echo across the body of international guidance and recommendations issued in response to COVID-19. Reduce prison populations, respect rights. As of yesterday, there's been no confirmed case of COVID-19 among prisoners in the Republic of Ireland. This is attributed to early decisive action, effective infection controls planning, and the safe reduction of the prison population by 450 men and women, or just over 10%. We welcome this. It shows what is possible. However, we remain concerned about the impact of preventative restrictions on the human rights of men and women detained in prisons. We are concerned that preventive mechanisms that protect bodily integrity should not be at the expense of psychological integrity. And as Katuna has alleged, or has so well articulated, we are concerned that the current restrictions on prisoners' rights and regimes risk becoming normalised, particularly as we move from short-term emergency responses towards medium-term realities of living with COVID-19. And we are concerned that with fewer people going in and out of prisons, no family, no teachers, fewer psychologists, that there are simply fewer eyes on what is happening behind prison walls. In this regard, the role of independent external oversight has never been more critical. And so we welcome the opportunity to hear from the many experts in this room and share learnings this morning. Of course, we cannot sit in this room without mentioning Ireland's ongoing failure to ratify the OPCAT, a treaty Ireland signed in 2007. It is our view that the COVID-19 crisis has only served to highlight the significant role and benefit of a national preventive mechanism to protecting all people wherever they may be deprived of their liberty. To this end, we warmly welcome the participation today of bodies that will have a role in the future NPM in Ireland, along with NPM members in the UK and our civil society colleagues across both of these islands. We look forward to the presentation by Dr. Modwick and the expert input in what promises to be a very valuable discussion. Thank you.
Thank you, Fiona. And I know both of you have worked really hard to put this together at such short notice, so it's a really great opportunity. And of course, mainly to hear from Dr. Modwick, who I guess by reputation will be known to most people here. I think, Jens, you're speaking in a personal capacity today, but we are really interested in what you have to say. So over to you, Jens.
Thank you very much, Nick. I'm sorry I've had some technical problems, but I hope they're solved now. Can you hear me?
Yep, we can hear you fine, thank you.
Okay, I think I'll take off the video. Now you have seen how I look this morning, so I'll take off the video and speak only if that's okay, just to make sure that there's no disconnection here. Good morning, dear colleagues and friends. It's really a pleasure for me to be able to present some thoughts in this topic and to hear your reactions. I'm very impressed with the number of high-level experts that have come to participate in this very important topic. As we all know, this is not something we have been doing for 10 years. I mean, we have been maybe exercising our monitoring for a number of years, and we have basic experience in doing so, but none of us have vast experience with monitoring during the time of an epidemic. And we are all on a rather fertile ground here to find out what is the best ways to tackle this situation. Basically, the pandemic puts two challenges before bodies that are doing preventive monitoring of places of detention, or even doing general human rights compliance monitoring. The first one is that we now have a new area to monitor, that is the way the authorities manage the epidemic in places of detention. And we, in some countries, have new places of detention to look into, namely quarantine and isolation locations. The second challenge that we are facing is a methodological challenge. How can we continue our monitoring while respecting or accepting the restrictions in, for instance, human interaction that emerges from efforts to limit the spread of the epidemic? So there's a substance issue and there's a methodological issue, and I'll speak to a little bit to both of them. When we look at monitoring the management of the epidemic by the authorities, of course, what we want to monitor, as always, is whether procedures and conditions follow human rights and offer sufficient protection against torture and ill treatment, as well as, in fact, protection against detainees getting the COVID-19 disease. Just like with the war of terrorism, there are special concerns, that is to prevent the transmission of COVID-19, which may urge authorities to implement measures which do not sufficiently take respect for human rights into account. Prisons should be considered potential incubators of infectious diseases. Like other public residential institutions, the inhabitants live closely to each other and sometimes have physical and psychological disabilities, which may further increase the risk of spread of infectious diseases. Further, hygiene facilities and procedures are often limited, and access to health care is often do not meet those standards that apply in the outside world. When the authorities deprive a person of his or her liberty, they of course also take on the responsibility for their health. And this follows from the limitations of freedom of movement, but also from the fact that in most prisons, inmates are obliged to use the in-house prison health service and have only very limited possibilities of using the general healthcare system. In this respect, acquiring a serious disease during imprisonment due to lack of due diligence on part of the authorities, or receiving insufficient treatment for such a condition may amount to ill treatment or even torture. Considering this increased transmission rate in prisons, it's important to assess whether the management of the epidemic timely and effectively minimizes the transmission of COVID-19 and, in case of infections, provides access to adequate treatment with due respect for the dignity and human rights of the prisoners. The SPT advice of 25 March 2020 advises that states should identify and focus on vulnerable groups. They should reduce prison populations, thereby reducing overcrowding to allow social distancing. They should review cases of pretrial detention, review the use of immigration detention, screen prisoners at release, minimize restrictions on regimes, ensure compliant mechanisms functional, respect daily outdoor exercise, allow equivalent hygiene, ensure alternative methods to contact with the outside world, enable food provision by relatives, ensure medical isolation is not disciplinary, provide medical care outside the detention facility, ensure information about measures taken, protect staff, provide psychological support to staff, ensure that all points apply also to involuntarily admitted psychiatric patients. Many other instances, bodies, agencies have issued guidelines to states, and my organization Dignity have published a 10-point synthesis of available guidelines. And these 10 points can be summarized as 1, recall equivalence of care; 2, develop COVID-19 management plans coordinated with public health authorities; 3, only limit detainees' freedom as necessary and not punitive; 4, prevent virus A from entering, B from spreading inside, and C from spreading out of the prisons; 5, consider alternatives to visitations; 6, ensure minimum 1 hour in open air; 7, ensure accommodation and health care for released individuals; 8, give intergovernmental organizations access to fill service gaps, if any; 9, adopt alternative measures to maintain functioning of the criminal justice system; and 10, NPMs should file alternatives to physical visits and monitor quarantine locations. So this is not Dignity's point. This is a summary of the guidances that have already been published. However, SPT in their 25 March advice also made recommendations to NPMs on how to tackle the pandemic. NPMs should continue exercising their visiting mandate, taking into account legitimate restrictions imposed on social contact. It's incumbent on NPMs to devise methods of fulfilling their preventive mandate which minimize the need for social contact. For instance, discussing with authorities implementing standards, increased collection and scrutiny of data on places of detention, electronic communication with inmates and staff, NPM hotlines, track setting up of new places of detention, and enhancing collaboration with NGOs working with inmates. In summary, the human rights situation of people deprived of their liberty is under pressure from two sides: measures to prevent spread of the disease, quarantine, isolation, no family visits, etc., which impedes on human rights, and a substantial limitation of oversight bodies, including NPMs, to exercise their preventive monitoring. In this context, SPT's encouragement to NPMs to think in new ways is very welcomed and necessary. It would be very interesting at some point to take stock of this situation and gather the experiences from NPMs overall, where new and promising methods develop, which is very likely to happen, in my opinion. However, how then can NPMs monitor how the authorities manage the epidemic? First and foremost, this of course depends on the context and the way the system is organized. In centrally controlled prison systems, the NPM could engage with the central authorities and request the relevant information, such as in the prison system: 1, COVID-19 prevention and management plans, measures taken to reduce the prison population, procedures for screening and testing on admittance and release, measures taken to protect vulnerable groups, facilities and procedures for quarantine and isolation, procedures for family visits, procedures to protect staff, including contingency plans, and data on the development of the epidemic in each prison and detention center, and what you might call a health information system. And these topics will be the outline for what I'm going to say now. Just mention that in case of more decentralized systems with less central instructions, data would have to be requested from the single institution. It's of course still desirable to monitor how such instructions from the central authorities are actually implemented in the single institutions. Based on sufficient detail of this information, the NPM would be able to evaluate the actions taken by the authorities and make recommendations as appropriate. Starting with the COVID-19 prevention and management plans. Some authorities, for instance here in Denmark, are hesitant to make their prevention and management plans public, and nevertheless NPMs should be able to, possibly confidentially, to evaluate plans for management and prevention. While many of the measures to be considered will be dealt with below, an important overall feature of the management and prevention plans are which scenarios are in fact considered and planned for. Do the plans take into consideration scenarios where a major part of the staff and or the prisoners catch COVID-19? Is there a pool of temporary staff ready to step in case of substantial sickness absence among the usual staff? Are the lockdown measures foreseen acceptable and in compliance with prisoners' dignity and rights? Are measures likely to create substantial dissatisfaction among the inmates? Is there even a risk of riots or violent attacks against staff? So the overall evaluation of these questions may give rise to recommendations to the authorities. Next question might be, have the authorities effectively reduced the prison population? Since overcrowding is considered one of the main risk factors in prison for increased transmission of infectious diseases, any reduction of the prison population is likely to mitigate the spread of the epidemic in prisons. In addition, there will be a positive effect on public health because there's a constant flow of persons from the general population through prisons and back into the general populations. These measures could include, for instance, reducing intake by postponing serving sentences for as many as possible, and scrutinize the use of pretrial detention to make sure that all cases fulfill the legal requirements. Increased release could include early release of prisoners approaching the end of their sentence and releasing vulnerable prisoners when possible. In fact, the US-based NGO ACLU, together with researchers, calculated recently that substantial reduction in the number of arrests, that is, new pretrial detainees, would have an immense impact on the number of deaths due to COVID-19 in the general population. Substantial reduction of arrests, meaning only arresting people for violent crimes, could mean as much as 100,000 fewer deaths in the population. In connection with the reduction of the prison population, monitoring bodies could ask for specific statistics and release criteria to be better able to assess the measures taken. And if more should be done, the NPM might recommend to do so. Next question would be, have the authorities established procedures for screening and testing on admittance and release? This is related to the initial medical assessment, which is mentioned in the Mandela Rules, Rule 30. And according to this, all newly arrived prisoners should be examined by a medical doctor or another health person as soon as possible. And one of the things the examination is focusing on, apart from identifying torture in the treatment and other purposes, is to check whether prisoners are suspected of having contagious diseases and providing for clinical isolation and adequate treatment. So it's clear that the obligation to screen and test on admission has a clear foundation in international standards, although soft law standards. The actual implementation would rely on specific circumstances. For instance, which access do the prison health service have to testing for COVID-19? In case there's no access to testing, the screening would have to be performed based on the presence of symptoms and possible exposure to persons with positive tests. The consequence of this would be that many more prisoners would go into quarantine. As for access to testing, the principle of equivalence of care would apply. Thus, access for detainees and prisoners to be tested for COVID-19 should be the same as in the general population. At least, you could say. This is stated in Mandela Rules, Rule 24, about equivalence of care. The release of prisoners, which were mentioned above, should also follow procedures for screening and testing, so that the released person, in case of positive test symptoms or exposure, may receive the appropriate treatment and rely on appropriate accommodation. Again, deficiencies in the screening and testing procedures should give rise to recommendations. The next question would be, which measures have the authorities taken to protect vulnerable groups? And vulnerable groups must in this context be defined by the public health authorities as those with an increased risk of a serious or fatal cause based on their age and or poor health condition. Those groups should be considered for early release or parole to avoid a massive exposure to a potentially fatal disease. It may, however, be argued that there's vulnerability beyond the course of a possible coronavirus infection. An editorial in The Lancet on the 4th of April addressed this issue and made the point that also groups who struggle with the crisis financially, mentally and physically should be considered vulnerable. Some will rely on supplies from relatives, supplies that may now be cut off due to cancellation of family visits. Others experience an exacerbated fear for the threat to life and for the future consequences of the epidemic. In other words, the news every day feed into catastrophic thinking and paranoia with mentally ill persons. We already see that with the psychiatric clinics, that there's a deterioration on average of the mentally ill symptomatology. Communication and information are probably the most important measures to mitigate mental reactions to quarantine, isolation, and lockdown. Measures specifically must be taken in support of vulnerable groups. In addition to possible release, would be efforts to ensure information in a language they understand, access to hotlines, to news, and to meaningful activities. Next question would be, what are the facilities and procedures for quarantine? The information provided regarding facilities and procedures for quarantine should be clear and leave no room for estimation to prevent arbitrary or even repressive use of quarantine. The grounds for quarantine are purely medical, and the prison health staff should be the final authority in such questions. Nevertheless, quarantine may imply isolation for 2 weeks, which is very close to the upper acceptable limit for isolation according to the Mandela Rules, Rule 44. This stresses the need to ensure meaningful contact and activities for those in quarantine and isolation in order to prevent severe mental health consequences on top of the fear for getting seriously ill. This regime should be scrutinized by the NPM. As stated in the SPT advice, safeguards should apply for the use of quarantine. This should include the right to information about the reasons for the quarantine and the right to an independent medical evaluation, to legal assistance, and the right to inform third party. The facilities used for prison quarantine should be described by the authorities, possibly supplemented with photos from selected places in case visit is not possible. In single-cell facilities, the place of quarantine will most likely be the prisoner's cell, but in prisons with bigger cells for many prisoners, very often seen in developing countries, they might define dedicated rooms for all of those in quarantine. This poses particular difficulties in preventing transmission among those in quarantine and should not be used. Next question addresses procedures for family visits. They're obviously very important to prisoners as the way to maintain family relations and a minimal level of normality. The maintenance of family relations during imprisonment is also an important factor in a successful transition to a normal law-abiding life after release. While the epidemic provides compelling reasons for limiting at least the physical contact, the authorities should provide alternative ways of maintaining this important lifeline to the outside world. This might include extended possibilities for telephone contact and possibilities of video contact. However, the possibilities for relatives to legally provide food, clothes, and money to the prisoners should also be maintained and follow procedures which respect both safety and security. The NPMs could go into detail and ask for both procedures and statistics regarding the number and length of contacts between prisoners and relatives to be able to evaluate in detail how well alternative measures function. Moving to procedures to protect staff, including contingency plans. The information provided by the authorities under this topic should address all procedures of relevance to protect staff against COVID-19, be it transmission from other staff, from inmates, or from relatives. This includes access to means of protection, face masks, visor protection, smocks, as well as to disinfection, hand wash facilities, disinfectants, and information should be provided about any guidance and procedures for the use of these means. Of particular interest are situations where the use of force and close contact with inmates is required, such as putting on handcuffs, interrupting fights, body searches, and lead grip. Obviously, social distancing is not possible in such situations. It's highly desirable that the staff is well informed about what is expected of them in such situations, in particular vis-à-vis inmates known or suspected to have COVID-19. Another critical situation is the handling of dead prisoners. Procedures for how to do so, including possible use of personal protection equipment, should be available in all prisons. ICRC has published a very useful article on this. Another important area in relation to the protection of staff is guidelines for sickness absence, in particular for staying at home because of COVID-19-like symptoms. While many prisons suffer from shortage of staff and a high sickness absence rate due to stressful working conditions, it is important to prevent transmission that staff stay at home when they have symptoms. The risk of substantial shortage of staff at work due to COVID-19 should be mitigated by organizing a pool of temporary staff at call. It might be an option to perform antibody tests of staff to let those who have had COVID-19 go in frontline, working with confirmed or suspected cases. However, the correlation between presence of antibodies and immunity seems to be uncertain and therefore currently not a way ahead. I can recommend an article in The Lancet from 2 days ago, which is called "What Policymakers Need to Know About COVID-19 Protective Immunity." It's an excellent 2-page comment which summarizes what we know about immunity and antibodies in blood tests. NPM should evaluate whether efforts to ensure enough staff at work are sufficient. Has this anything to do with compliance with human rights? Well, obviously, of course it has. Shortage of staff is very likely to involve limitations of human rights, more harsh security measures, more use of force, less conflict resolution, and less dynamic security. The prison health staff is also at risk of acquiring COVID-19 due to the proximity when examining inmates suspected or known to have COVID-19. Again, access to means of protection and procedures for their use is key. Access to such means and to tests should be similar to those for staff in the public healthcare system. Finally, data on the development of the epidemic in each prison and detention center should be available. And this topic addresses the system's ability to collect and process data in order to monitor the development of the epidemic within the prison system. In order to have an effective health information system, data should be collected and processed day by day with regard to suspected and confirmed cases among newly arrived prisoners, among current prisoners, and among released prisoners. Thus, each situation should at any time be able to give an account of the number and development of suspected and confirmed cases, the number of cases in quarantine, and the COVID-19 status of released cases. This will provide an effective feedback to the prison health service and management about whether measures taken are effective and sufficient or whether more measures are required. This information should be available at the institutional level as well as at the national level. There's not enough time here, but I would like to state that many, if not most, of the considerations above would also be applicable to other types of places of detention, notably immigration detention centers, to some degree psychiatric departments and social institutions, for instance, for persons with development disorders, again, a population of high risk of a serious or fatal cause of COVID-19. The second question addressed in the SPG advice and elaborated here is the conditions for undertaking generic preventive monitoring during times of restriction of human contact. Is it possible and is it useful to uphold certain monitoring activities during the pandemic, or should the NPMs put down their arms? Many NPMs, as I understand it, have in fact put their activities on hold, considering that interaction between monitoring teams and prisoners would increase the risk of transmission to prisoners as well as to monitoring team members. The challenge, as clarified in the SPT advice, is whether NPMs could develop alternative ways of monitoring during the pandemic. There are several good reasons to move in that direction. First, torture and ill treatment do not stop during the pandemic. On the contrary, thus the need for oversight mechanisms and preventive monitoring is as great as ever, as I think I heard Fiona say a bit earlier. Second, measures to cope with the epidemic may limit the enjoyment of human rights, so maintenance of preventive monitoring may even be more needed than before the pandemic. And finally, maintaining awareness of the NPMs may be important also on the long term, because a discontinuation of activities and awareness may make it difficult to re-establish the position and respect that applied before the epidemic, and many NPMs may have to start all over in building trust and relations with authorities to be able to exercise their monitoring function. Then, which are the possibilities to monitor without breaching the social distance requirements and respecting the do no harm principles? First, as already mentioned, written information received from the institutions and central authorities. 2, interviews with recently released prisoners. 3, interviews with inmates and staff through video or audio connection. And 4, monitoring based on adapted visit methodology, complying with the social distance and use of means of protection. As regards to the written information, an NPM could request very detailed information about the management of the pandemic in, for instance, prisons, as a basis for evaluating measures and providing recommendations. The same applies to generic preventive monitoring. In the Danish NPM, we have developed a practice of requesting very substantial information before the visit. On the one hand, this practice means that institutions are notified that we will undertake a visit at some point. On the other hand, in a prison system where many activities, including all use of force situations, are put on record and reported to central authorities, there are limits to the beautification and cleanup that you're able to do in advance of a visit. Again, this is obviously depending on the context and the way the prison system is organized, but we have reached a balance where some visits are notified, some are unnotified, and some are partially notified. That is, we notify that within the next 3 months we will visit the institution. If a large amount of data are available, it may be relevant to consider requesting reports about use of force, including the supervisor evaluation of the reports and possible sanctions, about disciplinary sanctions, primarily punishment cell, security cell, observation cell, body searches and findings, threats and violence against staff and between inmates, suicides, attempted suicides and cases of self-harm, policies and measures to prevent violence, and procedures for initial medical assessment, including the number of cases of suspected torture or ill treatment identified through the medical assessment, and reporting of such cases to the competent authorities. It may be considered to ask for all reports from the last 3 years, from the last year, or maybe the last 5 reports, depending on the expected overall number. An evaluation of this information may give rise to recommendations of changing the practice in the institution, for instance, regarding use of force or the use of disciplinary sanctions. Regarding interview with recently released prisoners, Dignity has developed in a different context, though, a concept called indirect monitoring, which is an attempt to provide solutions to monitoring bodies which do not have access to physically enter the criminal justice institutions because the authorities do not allow so. This concept includes gathering of written information as described, in interviewing recently released prisoners and detainees about the conditions in the institution. While the authorities may refuse to collaborate, it is in principle a possibility to request names and coordinates of the most recently 10 or 20 released prisoners and seek an interview with them. Their contribution to building a picture of how detainees and prisoners are treated and how the detention conditions are may be highly valuable. Together with the written information, this may suffice to form the basis for recommendations. An advantage is that released prisoners are very unlikely to be subject to reprisals. Using video or audio contact to interview inmates and staff. Well, video contact is a potential way of achieving a direct contact with staff and also inmates during times of restrictions of human contact. I think we have all learned a lot in exactly this area during the last 5 or 6 weeks. However, as any monitor of places of detention will be aware, the creation of rapport and confidence is key to a successful interview, and video-based interviews do not carry the same possibilities of establishing such good contacts. However, obviously a telephone contact to prison management or staff could serve well as a way of elaborating written information. As for contacts with detainees and prisoners, this would also risk being an insecure means of communication and possibly put the inmate at risk of reprisals. Establishing a telephone link, a hotline for prisoners to call the NPM in cases of torture, ill treatment, or conditions of treatment approaching this could be worthwhile considering, but it would probably require quite a lot of staffing. I don't know if any of the participants have experience with this. Physical visits have been abstained from by most NPMs. This is likely due to the mutual risk of transmission, that is, the do no harm principle. Another reason, however, may be related to the use of protection equipment that may be required for maintenance of safety during a visit. In the early phases of the epidemic, social distancing may suffice as means of safety, but as the epidemic progresses and the knowledge of transmission by asymptomatic cases increase, this approach may no longer be realistic. Undertaking interviews wearing face masks, etc., is not likely to be effective due to the psychosocial barriers created by the protection equipment. However, the Majesty's Inspectorate of Prisons in the UK have developed a concept of short scrutiny visits, which are visits adapted to the epidemic and still able to obtain important information. I believe this concept is very interesting and will follow the experiences very closely. Can you still hear me?
Yes. Can you hear us then, Jens?
You can still hear me?
Yes. Well, we can't hear you because I think you've got your.
I can hear you very clearly.
Yes, I can hear you.
Okay. Have you finished now, Jens?
Okay, I have reached the conclusion.
Okay. Well, thank you for that then. There's a lot of content in there to consider, and I know people will be interested in.
Okay, in that case, I think I will end here.
Thank you. Thank you. I'll now move to just some brief responses from people who've lined up.
Yes, I think due to the poor.
Okay, I'll ask Malcolm to respond first. Malcolm Evans from the SPT.
Well, thank you. Can I ask, first of all, if everyone is able to hear me? I too have a fairly weak internet connection at the moment.
Well, I can hear you fine.
Perfect. Okay. First of all, thank you very much for this opportunity to speak to you all this morning. Just a few words to follow on, picking up on some of the points that Jens was making. No intention of repeating what he said. As you, Nick, said, there's a huge amount to think and reflect on. More interesting to hear what everyone else has to say. From an SPT perspective, Jens did say it would be good to know what's happening around the world. And from an SPT perspective, we've decided that that's one of the areas that we can perhaps work on that adds value compared to all the other things which everyone in this meeting and elsewhere is doing. And so we have written out to all states and NPMs asking for just loose leaf information about what they're doing by way of response and the challenges that they're facing. And we've asked them to send us that information, hopefully by the end of this week or early next. And we'll be looking at that in order to try to get some global understanding of what the range of problems that people have been running into are at a practical level. And also, I suppose, so we may be able to issue some further, I suppose, generic information or guidance as the SPT, but also we anticipate being able to intervene in support of NPMs in some individual countries where particular problems have come to light. And without wishing to name names, I can already think of 3 or 4 countries where we've already intervened to try to support them in their work on the basis of the problems that we see that they've been running into, trying to exercise some form of mandate at the moment. We're already seeing, you would expect, some evidence of challenges to rights of entry at all, whether or not people are NPM visitors are considered to be key workers and so on and so forth. So there's a lot of quite interesting information coming out of that exercise already. What I would like to do, however, in just a brief moment, and building again on what's already been said, in the introduction it was mentioned that there is a danger that all these restrictions which are being put in place run the risk of becoming normalized, and that this becomes the new benchmark from which we are working. That is, of course, a huge problem. What this is also revealing, however, I think, is the extent to which things which were not acceptable at a global, in many countries around the world, have already become normalized. Because if I'm listening to what is being said from Jens and others about what should be done in terms of the response, in terms of alternative medical provision, on looking on the chat, in terms of cohort entry and control, etc., etc. In so many prison systems around the world, this would be utterly unachievable because the norm is already so far away from what that actually is. And I think one of the big takeaways that I would like to see us as we move on from this in due course is use this as an opportunity to scrutinize what somehow we've already become willing to accept as normal in detention settings, because actually what this is showing is that those normal systems simply don't have the resilience or the scope or the capacity to be able to respond to situations such as this, and has really revealed in many countries in the world the appalling shortcomings of their current normal, let alone what that new normal might be. The other thing, and it's already been stressed, is we are almost certainly going to need to rethink in many ways what are the effective tools of preventive visiting, preventive monitoring. Much of what we've seen is actually hugely positive, and although it is being put forward as in some instances seen as a second best, there are many things which are now being done which are very good practice, which we can take advantage of and build into what we do going forward. And many of the tools which are now being brought in are more accessible for monitors in many countries than would possibly otherwise have been some of the traditional tools which we put forward, particularly in terms of remote monitoring. And so I do feel that for me, that's one of the other things that we need to think of, to try to see what some of the positives are about the new techniques that we are bringing in here. And the final point I want to make is that in those countries where there have been the most, if you like, hostile sets of relationships between the monitoring sector and the prison authorities, things have been very much worse than in those where they have had good relationships or not too bad relationships. And what we found in a number of countries is where there have been negative attitudes by detention authorities to the monitoring work of NPMs, where they have reached out to them, the NPMs and others, to try to demonstrate that they understand the problems for staff in relation to this, as well as for detainees. That has made a big psychological difference to the relationships between them all. And I can think of a particular example, and I'll finish with this, of one country where huge barriers were broken down when the NPM was able to organise the provision of personal protective equipment for staff that simply didn't have it, to enable them to be better able to go around doing their job within the prison. And all of a sudden, they suddenly realised that the NPM, the people were actually not just interested in the detainees, but they were interested in the reality of life within the detention facility for everyone. And that got people much more on side, made a much more positive atmosphere, and a much more positive outcomes are now being achieved in a lot of prisons within this country. And so there's a lot to reflect on here. Anyway, I won't do that reflection. There'll be a lot for other days to think of. But I'd like to thank Jens again for a hugely insightful presentation, and for you all for participating. Thank you.
Thank you, Malcolm. I think there were some points that arise from both what you and Jens was saying, that while there are aspects of what's happening in prisons and other places of deprivation of liberty and monitoring that we would want to reduce reliance on as quickly as possible, there may be other things that we actually want to keep beyond this time, and it's worth thinking about what some of those are too. I'm going to move now, before opening up to Eleanor Steinert, who's Vice Chair of the UN Working Group on Arbitrary Detention and has been key in developing ideas around this area. Eleanor.
Thank you. Good morning. Thank you, Jens, for your very insightful presentation. Thank you to Katuna and Stephen for organizing this very important event, and thank you for having me and allowing the perspective of a working group on arbitrary detention on these issues as well. Before I say anything, I also wanted to say that, just as Jens, I'm also speaking in my individual capacity. You may have noticed that the working group has not yet formulated any guidance on issues surrounding the COVID. That is not to say that that's not coming, but therefore whatever I say today is said in my private capacity. I'm coming from a slightly different angle to this discussion, in that instead of looking at conditions of detention, instead of looking at treatment of detainees in the context of current pandemic, I'm looking at the question of detention itself, a question of legality of this detention in the current context. And when I pose the question of legality of detention, I'm not only asking to look at the national legislation, at the legal basis for any given deprivation of liberty in any context, but also we look beyond the letter of law and examine the requirements for proportionality and necessity of any detention. Because as we all know, the fact that a detention is legal under national law doesn't mean that it could nevertheless be arbitrary under international law, as it fails the requirements of proportionality and necessity. And I think these questions of necessity and proportionality are particularly pertinent in the current context of the pandemic, as what was necessary and proportionate before the pandemic has necessarily may have changed as the fundamental circumstances surrounding the conditions of detention, surrounding the individual who finds himself or herself deprived of liberty, have necessarily changed. And that is more prevalent, I think, in some detention contexts than perhaps others. There is also, of course, additional deprivation of liberty contexts, completely new contexts, relatively new contexts that have arisen. For example, the compulsory quarantine, which still needs to satisfy the questions of legality, of proportionality, and of necessity, because there is no possibility for any state to derogate from the absolute prohibition of arbitrary detention, of arbitrary deprivation of liberty. That applies also in the current pandemic, also in the current emergency legislation that many states are bringing forward. Any deprivation of liberty still must satisfy these questions of proportionality and necessity. So I'm coming in this discussion and in this very interesting morning today from a slightly different angle, even before we enter the detention setting as such and think what can we do and how can we do it. I ask the question is, should this detention, should this deprivation of liberty still remain in the current context of pandemic? Thank you.
Yeah, thank you for that. I mean, that's, again, going back to the point about things we may want to maintain. It's interesting that certainly in England and Wales, prison admissions have reduced by about 3,000, I think. So you have to ask, well, why previously to that were some of those people being imprisoned in the first place? And finally, in terms of invited speakers, I'm going to go now to Mark Kelly, first Vice President of the CPT. Mark.
Good morning, Nick, and thank you very much to Fiona and to Stephen and to Katuna for all the work that's gone into organising the meeting. One of the very first things that the European Committee for the Prevention of Torture did when the implications of the pandemic began to become clear was to issue a statement of principles 10 principles, which we think should be of general application. And you can find those listed in the bulletin that Katuna distributed to participants yesterday evening. I'm not going to go through them in detail, but they resonate very much with the issues that were raised in Jens's presentation, and also with the guidance that has been issued by the SPT. And like the SPT, the CPT has written to member states, to the 47 member states of the Council of Europe, asking for detailed information about the steps that they're taking to protect prisoners during the pandemic. So I hope, Malcolm, that the SPT and the CPT can collaborate a little bit on that, particularly as we will both have made similar information requests to Ireland and to the UK and to quite a number of other countries. It's a good opportunity for cooperation. What I would like to do very briefly is talk a little bit in very practical terms about how we can actually do preventive monitoring during the pandemic. I want to pick up on 3 issues: feasibility, safety, and the do no harm principle. Feasibility, it's important to be clear about the fact that at the moment, it's simply not feasible for international monitoring bodies to do their visiting work in any effective way. International travel is suspended for the Council of Europe. We're dealing with 47 countries, some of which are EU and Schengen, some of which are EU and non-Schengen, like Ireland, some of which are non-EU, and even with very limited possibilities of travel within the Schengen area. At the moment, it's simply not feasible for a body like the CPT to assemble a visiting delegation and to put it in place on the spot, which means that the work that's being done by many of you as national monitors is more crucial than ever. So it's not a case, I think, either for the SPT or the CPT of saying, do as we suggest, but not as we're actually doing. We simply do not have the capacity at the moment to carry on our monitoring work. So we are hugely attentive to innovative practice that is being developed at national level. And I wanted in particular to welcome the work that's been done by the Inspectorate of Prisons for Scotland by Wendy Sinclair Gieben and her team. I think Wendy is with us this morning because the Scottish Inspectorate has very recently developed what they're calling a remote monitoring framework for monitoring during the pandemic. And what they've done is to take the CPT's statement of principles and under each of them produce a kind of detailed pull-down menu with benchmarks or indicators that could be monitored. I think it's a very interesting initiative, and it's something that I hope other monitors might also look at with interest. Secondly, safety. Now, many of us are used to taking certain sorts of precautions in places of detention. We're used to going to prisons where there are people that may have contagious diseases like tuberculosis, for example, and particularly the medical members of delegations will be used to using PPE appropriately during those sorts of interactions. But now we have another dimension that we have to think about, which is actually safety among the delegation or the visiting team itself. The other 2 colleagues from the CPT who are also on this call this morning, Hugh Chetwynd and Alan Mitchell, good morning to both of you, were with me recently in Greece, where we carried out a rapid reaction visit to immigration detention centres. And that visit was actually the last one that the CPT was able to carry out, and it was already happening during the pandemic precautions that were being taken by the Greek authorities. And it was a very complicated visit to carry out, even just in practical terms, thinking about things like physical distancing where delegation members themselves are concerned. So the safety of our staff in Strasbourg and of delegation members is something that we need to think through in an entirely new set of ways. And then lastly, the harm avoidance principle. Yes, Nick.
I'm just I'm slightly conscious of time because I want to open it up to others. So maybe
sure.
If you could draw your remarks to a close, then I can.
30 seconds on harm avoidance, which I think is a huge preoccupation for all of us. This is probably the single most difficult issue, and within it, how do we effectively carry out private, confidential interviews is, I think, for the CPT, one of the biggest unresolved questions at the moment. And I listened carefully to the suggestions that Jens had, but I think he also sounded a note of alarm around the potential to do private interviews while maintaining, but through any means other than direct physical contact, while maintaining rapport and confidentiality. I think that is, for us, when we begin visiting again, which I hope we will do as soon as it is feasible and safe, that's going to be the biggest issue to resolve. That's certainly an issue on which we're hoping to learn about more innovative practice that may be adopted by national monitors. Thank you.
Thank you, Mark, and sorry to interrupt. You can't really kind of catch people's eye on this in the same way as you can in practice, can you? And I think that point about private interviews is really important, because I think while the sort of virtual monitoring can give you a general picture of what's going on, to identify individual mistreatment or torture, you need to speak to people individually. I can't personally see a way around that. I have got some people from the kind of wider group who want to participate. So I'm going to throw that open and then see if there's any responses at the end. So remind you, if you do want to ask a question or comment, use the chat forum to do that. I know that Deb from Inquest has got a contribution she wants to make, so I'll go to Deb first. Deborah Coles.
Hi, thanks so much for organising this. It's been really, really interesting. I'm the CEO of Inquest, a charity that works around deaths in all places of detention. And my question really is about the concerns that we have about post-death processes and investigations at this time, and the kind of clear human rights obligations that there are on ensuring independent and effective investigations, both in terms of scrutinising the treatment and care of prisoners, particularly at this time, but also important questions about prevention, learning and accountability. And I think it's really a question about whether or not some consideration could be given to issuing some guidance around how these investigations can be continued. And I just taking up from the previous point about private interviews and confidentiality, obviously at a time when there is very limited external scrutiny, there is a real concern that, of course, human rights abuses could occur and ill treatment, and access to prisoners in terms of their accounts of what's gone on will be really, really important. And I am just really quite nervous that I don't think there has been proper attention to how investigations will be carried out across places of detention. And I mean, I know this has been primarily talking around prisons and immigration detention, but I'm also concerned at the complete absence of data and information coming out of mental health settings and learning disability settings in terms of the number of deaths that are occurring, both of patients but also of staff.
Thanks for that. Yeah, thank you for that, Deborah. Let's just pursue this point about kind of telephone monitoring and conversations. Philippa, you made quite an interesting, Philippa Tomzak, you made quite an interesting comment that sometimes doing things by phone might be easier in terms of getting rapport, I think is the point you're making. Do you want to say a little bit more about that?
Just a very basic point, that this is just from general research methodology, not from prison specific, but people always sort of really privilege face-to-face interviewing, sometimes for good reason, but there is some literature indicating that telephone interviewing can actually make it easier to talk about sensitive topics. So this is not done in the prison setting. This is just general methodology, but I think it's important not to discount those virtual methods. That was it.
I think that's quite a helpful point. And congratulations on your research award, by the way.
Thank you.
We weren't able to get anybody from the independent monitoring boards to take part in this, but I don't know whether Louise Feiner could say anything about the work that they're doing to kind of try and deal with complaints by a dedicated kind of telephone line. I think there's a pilot underway. Louise, are you able to say a bit more about what's happening with that?
Not very much more than they have already published. I mean, they've rolled it out in a certain number of prisons, and at 6 weeks, I know there's been some discussion on the chat about why a pilot and why 6 weeks. I mean, it's been a very significant undertaking to set up. So I think they're keen that at the 6 week point they review what's worked and what needs improving, and they're definitely planning to roll out more widely. I'm afraid I can't really say any more than that.
Okay, and there is some experience from whoever is iPad 3 who has just said to me that their visits in the Republic of Ireland prisons have continued, and they'd be happy to say something about that. So who's iPad 3?
Good morning, iPad 3, also known as Patricia Gilheany, the Inspector of Prisons.
Hello, hi, there we are.
Good morning. Just to briefly share that during the pandemic, I suppose our office is very cognizant of the fact that when liberty has been restricted generally in community, that the risk of enhanced restrictions in prisons is increased, and therefore oversight is particularly more important. So at the outset, as you know, we have a very small team. There are myself and two colleagues who actively work in relation to the inspection of prisons. And we put in place a range of measures. The first was taking the principles of first do no harm, but at the same time being cognizant of less people going into prisons. We felt it essential that those monitoring and brief scrutiny visits continued. So one person, i.e. myself, has visited all of the prisons. There are only 12. I've visited 12 prisons since the pandemic commenced. I have spent the last 2 days, 12 hours on one day and 10 hours on the other, immersed within one of the prisons. And the prison was chosen because I was particularly concerned about the numbers of people who, the term we're using here, were being cocooned because they were considered to be particularly at risk, because it was practically 50% of the prison population. And that was extremely insightful. I had free access to all areas of the prison and to all prisoners, including those who were in quarantine. My background is formerly in the area of healthcare, so I was quite familiar with wearing PPE, so that was no challenge whatsoever. And I met with prisoners in quarantine. I also met with prisoners who were released from custody yesterday, and had unfettered individual interviews with them to hear of their lived experiences. So that's in terms of the visits, that's one of the things that we are doing. Secondly, for the last 4 weeks, there has been a minimum of weekly telephone contact with the governing governor of each prison. And there is a standardised template that we developed, not unsimilar to our colleagues in Scotland, where we have taken the relevant principles and have a standardised checklist. My two colleagues contact each of the prisons once a week to get an update on activity there. I think what's important from an Irish perspective is to say that the interventions that have been taking place are being led by a senior official within the Irish Prison Service, the executive clinical lead, who happens to be a specialist in public health medicine. He's also a member of one of the subgroups that the government has set up in relation to a national public health emergency team, NFIT it's called here, and he sits on the vulnerable people subgroup, so that the restrictions that are being placed within prisons are equitable to the restrictions that are being placed in general society. And I think that's particularly important to bear that in mind. We receive each iteration of the algorithms that are distributed to the prison system to identify those that are at risk and the minimal interventions that are necessary in each circumstance. So we receive that information. The information available to prisoners has increased exponentially, so I hope that's one of the things that will continue after the pandemic ceases, because there are there's frequent literature made available. Challenge there is the language barriers, and translation at present is in 3 languages, and they're rolling that out to more. Also, I think important for us was to capture the lived experience of the people that were being cocooned. So those that were subject to additional protections, which by its essence means during this pandemic additional restriction. So I have issued a journal to approximately 85 prisoners in 8 prisons for a period of 14 days, and that will finish now the weekend. And 2 colleagues in Maynooth University, Dr. Ian Marder and Dr. Joe Garrahy, are going to assist me in the analysis of those journals. There's no questions in it. It's literally free text, free association, as Freud had put it. So I'm very interested to see the content analysis about the lived experience of those being cocooned. The intention is to analyse that data as quickly as possible so that the learning from it can be utilised as the pandemic progresses. I think it's important that the restrictions that are in place are there for the minimal amount of time that is considered necessary, that they're proportionate, and that, of course, that they're legal. So we will continue to maintain our oversight activities during this time, and any assistance or advice from our international colleagues will be more than welcome. Thank you.
Thank you for that. That's really interesting. I'm wondering whether we haven't heard from anybody about the situation in Scotland yet. So we're kind of moving around Ireland and the UK. It'd be good to get a Scottish perspective. I think Wendy Sinclair Gibbon is taking part. Wendy, are you taking part? Maybe she didn't join us. Is anybody else from the Scottish Inspectorate or the Scotland who'd like to say a bit about what's happening there? No? Okay. While you think about that and I work out someone to pick on, there was a question from Andrea in Australia around whether people are got any experience of using video contact and how that might work, particularly for people who've got in any circumstance kind of communication difficulties. Do we know whether there's any whether that's been used at all anywhere? No. Okay. I'll let you answer to that. We don't seem to have any experience of that. One of the questions I was going to ask people, which I think came up in the, I think it was Deborah, but I may have mistaken this. I think there's a real, so one of the issues in the UK more generally is around the death rate in care homes. And the focus, I think, has been very much on care homes for the elderly. I think there's some real issues around what might be happening in secure social care settings, so particularly for people with who are on the spectrum of autistic disorders, people who've got behavioural difficulties, those kinds of things, where they are detained. And whereas we know there has been quite high-profile examples of abuse and ill treatment in the past, and I'm not sure whether we've got anyone here has any information about how that monitoring is going on. We didn't get anybody from the CQC to take part, but I think that area, those types of places of deprivation of liberty are a real area of risk at the moment, because they're smaller, because quite often they won't be under one national system of control as the prison system is, and then whether they're getting the level of attention they need to. I wonder whether anybody's got any information or thoughts on that. Yes, yeah, got Deborah. Is that you waving? Yeah, use the chat. Yeah, there you go. Use the chat going up, Deborah. Your mic isn't on yet. Hang on.
Deborah, unmute yourself.
Yeah, got you now. Deborah, you're muted again.
Dear, I'm not doing very well here.
Right, we can hear you. Go on.
Oh, can you hear me now?
Yes.
Yes, sorry. Yes, Nick, you're right. I raised it in the context of our concerns about deaths of people detained in different settings, particularly mental health settings. And I'm disappointed that the CQC couldn't join today, because I think there is a real issue about the absence of data on what is actually happening within those institutions. We've tried to get that information, and I'm also using the Independent Advisory Panel on Deaths in Custody, on which I sit, to try and find out exactly what the extent of the virus is, both in terms of patients and staff. But I think importantly, the impact that this is having on restrictions to therapeutic services, perhaps increase in the use of restraint and isolation more generally. And obviously, we're not yet aware of any of the data around whether or not they've actually been COVID deaths or indeed related deaths, because I think it's important when we're looking at deaths, not just to look at COVID deaths, but also deaths, for example, self-inflicted deaths that could well be the result of increased, isolation. So I'm carrying on trying to find that information, and I'm more than happy to share if we're going to have a kind of follow-up conversation. I'm more than happy to share what I find out, but I do think it's a concern, and there's been a lot of welcome attention, I think, on prisons and on immigration detention, although the information on immigration detention, as Ali's been pointing out in the chat, is less visible. But I think there's been a lot less on other places of detention, such as mental health settings and learning disability settings.
That might be something to follow up. Yeah, I've got Susan indicating. As I say, if people use the chat to say they want to speak, then I will be able to spot you, because you're not all on my screen. Susan Finnerty.
Yes, hi, I'm the Inspector of Mental Health Services in Ireland. And just to pick up that point, we've been given extra powers at the moment to actually risk assess mental health services and mental health facilities. That involves getting a baseline of any risk factors, such as the number of people with COVID, the number of people who are suspected, the number of staff that are suspected of having it, the number of single rooms, that kind of information, and drawn up a risk profile from that. And that has been most helpful, because we are able then to give that information to the HSE and to escalate anything of high risk. So we have been quite successful in highlighting areas where PPE might be short, where they've had a cluster of COVID, where they've had a number of deaths, and we've been able to escalate and things can move quite quickly. We also get notifications of deaths from COVID and from any other cause of death directly notified to us. So we do have a figure of and numbers of actual deaths in the mental health services. Now that doesn't include the nursing homes or the residential care for people with intellectual disabilities. That's covered in quite a similar way by HICWA. So we do have quite a lot of information. At the moment, our inspectors and other members of the regulatory team are contacting each facility at least, we've about 176 of them, at least once a week, more if necessary. We have built up a relationship with the services there that they feel comfortable to ring us and do that. So that's where we are with the mental health services in Ireland.
That's really helpful. I think one of the values of this is the capacity for us to share experience right across the Irish Sea between what's with each other. So that's really useful to know. Just a couple of people I wanted to kind of bring in now. I've seen Nikki Padfield from Cambridge. I think you've been raising an interesting point on the chat. Do you want to expand on that a bit, Nikki Padfield?
I don't think that I do particularly want to add anything to what I've written down. Partly, I think the huge awareness that everybody at this meeting has about the miserable conditions that many prisoners find themselves living in at the moment make the importance of effective monitoring so much more important. And long term, we have to worry about how we measure the effectiveness of monitoring. But personally, my main concern at the moment is in how we check that these prisoners who are behind their cell doors for so many hours a day worry about their mental health and their well-being. And I'm, like everybody else here, thrilled about what the Prison Reform Trust, the Howard League have been doing, and anything that we can do to encourage greater concern for the reality of the lived experience, as they say, of people in prisons at the moment is hugely, hugely important. So there were two threads, I think, to what I was raising in the chat.
Yeah, okay, thanks for that. I'm kind of conscious of time, and we did say I'll try and, I think we're going to run over slightly, but I don't want to go over too much. I'm just conscious I haven't given anyone from Northern Ireland a chance to come in yet, so I don't know whether any of the Northern Ireland bodies want to make a contribution at this point. Maybe you could kind of wave or raise your hand if you do, but don't feel you're obliged to if you don't want to.
I can if no one else is going to.
Thank you.
So both the Chief Inspector and I have. Sorry.
You want to just introduce yourself?
Oh, okay, that would be wise. My name's Leslie Carroll. I'm the Prisoner Ombudsman for Northern Ireland. So
Hello,
both
Leslie.
myself and the Chief Inspector have been into two of the prisons, and we'll visit the other one. We have 3 sites, 4 prisons, sorry. We have not been given, I'm interested that in the south of Ireland, you've been given access to the cocooned prisoners. We haven't been given that level of access. We have seen the video calling, the Zoom visiting meetings that prisoners are having, few technical difficulties as you would expect, but basically that's going very well. Our IMBs are checking in with prison authorities, either by phone or in person. We're hoping that one of the independent monitoring boards will be able to do a short inspection of our CSU in our largest prison. We don't have any prisoners who are testing positive. We have some prison officers who do, so far it's been successful in terms of keeping the virus out of our prisons, and prisoners are extremely cooperative. Complaints are low. I have a free phone line that has remained open throughout, and we haven't seen any vast increase in complaints. If there are COVID-related concerns, I try to escalate and expedite them as quickly as possible given the circumstances.
Okay, thank you very much for that. All right, I'm going to draw things to a close now. I fear we haven't done proper justice to Jens's excellent presentation, which, remind you, will be available. All of this will be recorded. but I'm sure people will want to see how some of these themes can be picked up and continued kind of beyond today. Jens, I ought to give you a chance to say whether you want to come back on any of the points you've heard or anything additionally you want to add briefly.
Thanks, Nick. Unfortunately, I was thrown off during most of the debate after I finished the presentation, so I don't feel that I have anything to come back on, unfortunately. I will, however, look at the recording so that I can pick up on the discussion that took place while I was gone.
Yeah, no, do that. I have had that experience myself. It can be, not today, I have to say, but it's always, you have your slightly heart in your mouth when you do these things. But just to finish, just to say thank you really very much for that. I think it's a really powerful and practical presentation that I hope we are going to be able to take and run with across the UK and Ireland. So to conclude then, I'm going to ask Fiona first and then Katuna just to say a few words at the end.
Thanks everyone for their input. I think what stands out for me really goes back to Jens's clear point at the beginning, that torture and ill treatment does not stop during the pandemic, which just underscores the importance of this conversation and the work of all the inspection and monitoring and oversight bodies here. We're mindful that the pre-existing challenges and concerns continue in Ireland, in particular the ongoing detention of people with severe psychiatric illness in prisons and the 8 or 9% who are on 21 or more hour lockup anyway. Just to pick up on Malcolm's point about norms and just to underscore that minimum rights are not goals, they're starting points, and just to retain that throughout. And I'm really struck by the point about relationships and the positive outcomes of good working relationships between inspectorates and the prison authorities. And this has been echoed both by the Inspector of Prisons in Ireland and the Chief Executive of the Health Information and Quality Authority in the comments. And just to reflect further really on one of the other important points in Ireland certainly has been this cooperation between prison staff and prisoners by way of the Irish Red Cross programme. And certainly this has been crucial in keeping people safe. Just that, and just to underscore that. And I'd just like to brief thanks, we'll just whistle stop through, of course, to Jens for giving his time this morning, to Nick for his expert chairing, to Malcolm, Alina and Mark for their expert input, to Katuna and the Sahid Mubarak Trust for the cooperation, to IPRT staff who've been doing bits of work behind, and of course to Stephen Caruana, just to say we all willingly mispronounce your name in Ireland as Cara Nua, which translates from Irish into English as new friend. Thank you, Stephen.
There we are, how cute. There we are. Katuna, final word to you then.
Thank you, Nick. It was a pleasure to hear that there has been no confirmed case among prisoners in the Republic of Ireland and Northern Ireland. Unfortunately, we have very different picture in England and Wales. There is a huge disparity between the officially reported data on prisoners and staff affected by COVID-19 and the recent estimates from the Public Health England. We need effective monitoring of what's going on in prisons, and we need it now. The latest information we have about the number of people released under the early release scheme stands at 33, including pregnant women. We need immediate action on increasing this number to save lives in prisons and in the community. There is a lot to take from today's seminar, which will inform and shape our work in the coming months. One takeaway message for me is that all countries are facing tremendous challenges and difficult decisions. But an emergency situation does not allow free rein to disregard human rights and public sector equality duties. We need to keep you informed. We will keep you informed about future events and will distribute the final list with contact details unless asked otherwise. And thank you everyone for a lively and engaging discussion. Dr. Jens, Fiona, Pamela, Stephen and Nick for making this happen. Just the last words that we are physically distant today, but we stand together during this crisis. And on that note, I wish you all continued safety. Thank you.
Okay. Thank you, Katrina. So just to conclude then, what will happen next is we will circulate the recording of this event, and hopefully we've saved the comments that have been made on the chat. I've already seen people have helpfully put up a lot of material and other references there that we will be able to, will be useful to people. And I think, and we'll also circulate, unless you tell us otherwise, the attendance list and your email contact details, because it may well be that people will want to get together subsequently to pursue some of these issues. It does seem to be some quite important materials come out about the standard and level of monitoring that's happening across the jurisdictions that we are interested in. I think for me, this question about a gap about other places of deprivation of liberty outside prisons is a real concern. I think myself about sort of the middle stage of all of this, the point at which the restrictions start to be eased in prisons is going to be a time of real risk, because at that point you'll have a population who are largely unaffected, who then start to get exposed to